Let's get started. Welcome everybody to this information session where you can find out all about registration as a public health practitioner with the UKPHR in the Yorkshire and Humber region. So can I invite somebody from the PPYH team to do the housekeeping section?
Yeah, sure. So we're on a Teams town hall session today, and it is being recorded, and your mics and cameras are currently off. Any questions, please put in the Q&A box there, and we'll gather those questions, and at appropriate times throughout the webinar we will put them forward. If there is any questions that aren't answered, then we will update our FAQs, and they'll be available within the next week or so. Thank you and enjoy the webinar. Over to you, Alex.
So I'm Alex Shepherd and I'm a registered practitioner. I completed my registration back in 2017 and I've been working in public health for 25 years now. Crikey, it seems like a long time. And I've worked in different domains of public health as well. So principally in health promotion and healthcare public health. I've done a stint in health protection as well. And nowadays I focus more on workforce development, but I also still have one foot in the practitioner workforce as myself and a group of colleagues with Health Talks, we deliver school-based interventions and community-based training. So we're working with Gypsy Roma travellers at the moment with some National Lottery funding. So I've got one foot in the workforce still and one foot in workforce development. So I'm hoping that that experience will enable me to answer any questions that you might have today. I'm also the scheme coordinator for the Midlands, the Northwest and the East of England. So I've registered over 250 practitioners to date. So hopefully I will be able to help you on your practitioner journey. These are the aims of today's session. I'll just give you a second to read those. Registration is a relatively complex procedure actually, but it is something that you only need to do once in your career, I'm pleased to say. And registration as a UKPHR practitioner is still a relatively new thing if you compare it with all of the other professional registrations, the GMC, the GDC, the NMC, all of that sort of thing. Registering the public health workforce only really started in 2011 as a specific specialty. So, and for a while it was seen as a very optional. You could either get registered or you don't have to be registered. However, in the last 5 years, it's become more of a part of the career furniture in public health. If you want to progress your career, you need to gain registration. So really, it's not a case of if you become registered, it's a case of when you become registered. So we're finding more and more people starting off that process. And you can start the process of preparing for registration at any point in your career. So even if you're relatively new to public health, there's a lot you can do in the preparation stage. And then once you're working as a senior practitioner, then you will be eligible to join the scheme, because the eligibility criteria is quite set, and it's really important that you do the preparation before you join a scheme. And that's what I'm going to help to show you today. So the main key document that we use is the guidance document. We call it the rules and the answers because it is both. The guidance document sets out all of the processes that are required by UKPHR, the National Register. And each region in the country has a practitioner scheme, Those schemes may look slightly different in the types of support they offer, but all of them will follow the guidance document and have the same processes. So we have a standardised UK-wide process for registration, and the terminology, the roles are all explained very clearly in the guidance document. Now, it's 66 pages of scintillating reading, but at this point I would recommend that you specifically look at sections 1 and 2 of that guidance document, because 1 and 2 really do cover all of what I'm going to talk about today, and start to familiarise yourself with the terminology that we use. It's the only document that I actually recommend that you print off, because you will be using it throughout your portfolio process. And it's useful to have a printed copy so that you can make notes on this as you go along. It's the only document that I recommend that you print out. And it has got a very clear content section, which means you don't have to sit and read it all in one hit. But sections 1 and 2 are definitely important for you to read. So let's talk a little bit about UKPHR as an organisation. It's a teeny tiny organisation, actually, based in Birmingham. They simply hold the register. So they are an accredited register with the Professional Standards Authority, what we call a voluntary register. So the difference between a voluntary register and something like the GMC is exactly that. It's a voluntary register, but although they still have exactly the same guidelines and requirements. And in fact, the chief executive of UKPHR used to be part of the GMC. So it was run along the same lines as all of the other more clinical registers. But there's 4 categories of registration, but 2 main categories. So specialist register and the practitioner register. Unlike other areas of health, public health isn't quite as hierarchical. Now, you might see that it is hierarchical if you work in either local authority or in one of the statutory bodies like UKHSA, where you have a very clear chain of command, as it were. So the Director of Public Health, the consultants, the registered practitioners, and everybody else. And UKHSA is the same. However, we know that public health happens in a variety of different organisations. So don't feel that you are at a certain level or capped at a certain level if you choose practitioner registration over specialist registration. So in my own case, I chose to go down the practitioner registration route because I wasn't planning on working in local authority. And I've actually had national roles in my career, managing teams of consultants. So there's sometimes people are a little bit confused as to which register to go on, either practitioner or specialist. And I would always say practitioner is a really good place to start. If you then decide that you want to go on and become a consultant in public health, you can then choose to go on the specialist register through the training programme or through the portfolio route. A lot of people also say to me, oh, I've been working in public health for 20 years, therefore I must be at specialist level. It's very different. The practitioner register does not require you to have worked across the different domains of public health, whereas the specialist register does. Gaining practitioner registration will certainly help you in your application to become a specialist if that's the route you want to take. But like I said, don't feel that it's necessarily a hierarchical route because you don't actually have to be a consultant in public health to lead national programmes. We've actually just registered the national lead for adult vaccinations in the Midlands, for example, and she leads a massive team of doctors, consultants and everything else. So it's not quite the same as other clinical specialties. And there's also the public health practitioner by apprenticeship route. Now, if you are interested in the apprenticeship route, you would go through your employer to look into that type of registration. But these links are live on the slides, and these slides will be shared with you after the session. On the UKPHR website as well, there's a little quiz that you can take to see which type of registration is more suitable for you. So that's a little bit about UKPHR. UKPHR as well, just to mention, they govern each regional scheme. So the assessors and the verifiers within each regional scheme are all trained by UKPHR, but you can't apply to register with UKPHR directly. You have to go via a regional scheme. And to be eligible for a regional scheme, you have to be employed in a public health role within that region. And I'll go into eligibility in a little bit more detail later in the session. Now, I'm just going to give you a second to read that slide. I would say now that we're seeing more and more employers adding registration as a requirement for jobs. So it absolutely improves your employability, gaining registration. It improves your confidence in public health, and it gives you the opportunity to revisit your theoretical knowledge. Now, given the fact that many of us learn via osmosis, we learn by doing, and we learn by the little bits of research we have to do when we take on a new project. Practitioner registration enables you to gather all of that theoretical knowledge together under a framework of the UKPHR standards. It does change your practice, it improves your practice, and it enables you to feel part of that public health professional family, if you like. It also helps you to plan your CPD requirements. Every employer in the country seems to have a different process for appraisal and CPD planning. So it's a really good thing to be able to take that out of your employer's hands and to feel part of the public health workforce nationally, working with the nationally agreed frameworks and standards for UK public health practice. So just a little note about membership versus registration, because people often say to me, well, I'm a fellow of the RSPH or I'm a member of the faculty, I don't need registration. Well, they're two completely different things. Membership can be purchased, registration has to be earned. So in terms career-wise, registration is far more valuable. I would say as well that RSPH, fantastic organisation, but probably more suitable for the junior and the wider workforce in terms of membership, whereas the Faculty of Public Health looks after the senior workforce. And they also offer a really comprehensive CPD programme and recording system. So when you become a registered practitioner, you are eligible for practitioner faculty membership. So if you're going to opt to be both a member and a UKPHR registrant, I would say that the faculty is certainly the more appropriate one for your level of practice. But membership and registration are two different things. When it comes to frameworks for career development, I'm sure you've all come from lots of different backgrounds in public health. Some people may have come through the voluntary sector, some through different local authorities, some through the NHS. And you see that there's lots of different frameworks out there for career planning. Now, we've got the Public Health Skills and Knowledge Framework, which some of you may be familiar with, which many job descriptions are based upon. And you may have been using the PHSKF for your career development so far, which is good if you have. Now, the UK PHR standards themselves are a framework. And when those standards were developed, they map quite clearly to the Public Health Skills and Knowledge Framework. And some of them were taken from there directly. And once you've gained practitioner registration, then you go back to using the Public Health Skills and Knowledge Framework to add to your professional sort of skills passport, if you like. But it's really important, whatever framework you use, to make sure that it's embedded in your appraisal process. So we are coming into appraisal season now. Often it's done in Q4, people's appraisals for the following year. So it's very important that you, if you're interested in gaining UK PHR registration, have that chat with your employer. Let them know that you plan to gain public health registration, and that's what you would need to focus your professional development plan against. Looking at the standards, planning your CPD according to what you need to help you gain registration. And there is a link to the Public Health Skills and Knowledge Framework on that slide, should you want to have a quick look at it and refresh. Now, eligibility. Now, I really don't like these NHS England slides with the levels of practice, because as I said before, public health is slightly different to the usual clinical one level after another, especially if you work in the voluntary sector or if you work in organisations outside of your trad NHS ones. But it's useful just to look at to gain a sense of what levels we're talking about. Because at the end of the day, everybody who's practicing public health is a practitioner. However, an entry-level public health job would be round about a level 3. So you might be a health promotion assistant or a health trainer, somebody who's delivering public health messages. Even people working in the health and social care sector as healthcare assistants may well be delivering public health messaging, but that's very different to being a public health practitioner. The public health practitioner levels are the more senior, 5, 6 and 7. Now these equate to Agenda for Change 5, 6 and 7. However, many people aren't paid along the Agenda for Change pay scales now, especially if you're in local authority. So it's important to look at your type of job role. Now, I would say at level 5, that's the level at which you need to start thinking about registration, start preparing for registration. At level 5, you'll be working, some of your work will be autonomous, some of it may be following standard operating procedures. But level 6 and 7 is where you are eligible to start. So you should be managing and leading public health programs, designing and developing programs for groups and populations. So you won't be working one-to-one with individuals. You're working in public health, population health specifically. You should be contributing to policy and strategy. You should be competently evaluating programs. Like I said, leading and managing programs. And these public health practitioner roles are just around below the level of a consultant in public health. and that's your eligibility. Now, I'm just going to jump to the guidance documents. Excuse me while I skip pages. So on page 42 of the guidance document, there is some definitions that you need to look at when you're deciding whether you're eligible or not. It talks about the different levels of practice. So you have supervised practice, you have autonomous practice, and then you have advanced autonomous practice. So you need to be working at either of these two levels, autonomous or advanced autonomous, to be able to be eligible for practitioner registration. And have a good look at that and a good read of that, because the worst possible thing is for you to join a scheme and you're not quite working at the right level. It's setting yourself up for failure, as well as meaning that you're not prepared and not ready for registration. It's far better to spend more time in the preparation phase than to jump ahead too quickly. But I'll leave you to go back and have a look at that in your own time. Okay, so there's information on this slide, what we've just talked about. Your knowledge level, so your level of qualifications that you need for registration, should be broadly equivalent to a degree. Now, I would say in the last 2 or 3 years, probably 70% of the people who apply have already got a master's in public health. So if you have already got a master's in public health, fantastic. You're definitely, your knowledge will be at the right level. If you've got a degree in, a master's in public health, but haven't yet been working in public health for long enough, then you're not eligible. It's not about just your qualifications. It's about your qualifications and your experience in practice. We have a lot of inquiries from people who've graduated with a master's, and they've got their master's and they say, right, I'm now ready for registration. And we have to say, actually, you need to have been working at autonomous level for at least 2 years before you're eligible for registration. And that's because you need to gather evidence of all the work you've done. And if you haven't done enough work at autonomous practice level, you won't be able to compile a portfolio.
There are a couple of questions. They're not specifically related to eligibility.
Fire away.
So one of the questions is, what's the difference between the public health specialist and the specialty register? I think that might mean specialty registrar though, but I'm not sure.
That's right. So the specialty registrars are people who are on the formal NHS England training programme. So whilst they're training, because the training programme takes 5 years, whilst they're in training, they become a specialty registrar, and they have a type of registration linked to that status. Once they've completed their training, they then become a registered public health specialist. Next question.
It says, where does academic public health, e.g. health services researchers, public health evidence reviewers, fit within the practitioner role?
That's a very good question, and at the moment it doesn't. So we find that people working purely in academia very much struggle to gain registration because of the very practical nature of the public health standards. You have to be actually doing public health rather than working in academia. And I know the links are very close, and a lot of academics are working on programs that support the delivery of public health. But unfortunately, once you look at the standards in detail, you realise that actually you're not quite at the core to be able to gain registration. However, we do have a lot of academics involved in the practitioner registration schemes as assessors. because frequently you will have already a master's in public health. Potentially you may have some teaching or assessment qualifications as well. So I would advise you, if you're working in academia, to talk to the Yorkshire and Humber programme and see how you become a UKPHR assessor. Full training is provided by UKPHR, and by becoming an assessor, you learn how to assess portfolios, but you also learn about the content and the levels required. So some of our academic assessors have then gone on to do their own portfolios because they've actively sought out opportunities to fill the gaps in practice that their current job role is missing. So sometimes those working in academia, it's much better if you become an assessor first and then think about your own portfolio. Helps to give you a deeper understanding of the practical skills that are required. Does that answer your question? Is any follow-up needed to that?
I'll let you know if a follow-up comes into the Q&A, Alex. There's also a question that wants to know if people are eligible if they don't have a degree level qualification.
Yes, because we recognise that a lot of people, particularly who've been working in public health for a long time, don't have formal qualifications. But what you've done over the last however many years is go on multiple courses and do a lot of self-guided learning. So it may well be that you've done hundreds, in some cases, of courses with some of them recognised providers, but not necessarily gained a degree out of it. And the portfolio process will enable you to bring together all of that learning. And the programme also does offer some courses that you would do while you're preparing for portfolio development. So if you don't have formal qualifications, I would recommend that you spend the next year accessing the Yorkshire and Humber's CPD programme, is it the LSB year or the Faculty of Public Health workshops, whichever they offer, and then apply. Once you've done all the CPD that you need to do, then apply to the scheme next year. It's very difficult to do all the CPD at the same time as writing your portfolio. It's a better idea to do all the preparation work first. And I'm going to talk about how you prepare for portfolio development in the next part of the session. Are there any other questions?
There are. I've got a follow-up from the academic that says, what about someone working as a research data analyst within a research organisation in the NHS working with clinical and cohort data on public health projects?
That sounds to be very specialised and quite niche. Now, what you would need to do is you would need to self-assess against the UKPHR standards, exactly the same as I'm going to explain how to do for everybody else, and identify which areas you would need further development in. Because it may be that obviously the data and information standards, you're going to be brilliant on those, you're going to have all of those in place. Some of the more practical standards around project management, project evaluation, collaborative working, potentially, some of those wider, more public-facing standards you might find more challenging. But it really is a case-by-case basis, and you certainly wouldn't be automatically not eligible just because of your job title, because you may well have a broader amount of work areas than actually your job title suggests. So I would recommend that everybody on the call begins the self-assessment process, and it's up to you to then have a look and see, actually, I've got a few gaps there. I'm going to spend the next 6 months looking for opportunities to fill those gaps. And people do all sorts of things. They go on secondments, or they say yes to other pieces of work that are outside of their normal remit in order to give them the experience that they need to put into the portfolio. Any other questions?
There's just one more at the moment. It says, how is autonomous working defined? For example, if a role on paper would not be seen to be autonomous, but in reality it is.
Yes, that's quite a tricky one, isn't it? It's a case of looking at each standard by standard and looking at how you will evidence each standard. Because I guess in all of our roles, there's some areas and aspects of our jobs that are more autonomous than others. But you have to provide proof that you are working at autonomous level. You have to also provide testimonials from line managers to say, I confirm that whatever your name is working at an autonomous level. And you also have to gain references from senior public health professionals to state that you're working at autonomous level. So documentary evidence, testimonials from other people, references from other people, all of these things contribute to your proof that you're working at the right level. Okay, I'll move on and we will come back to another Q&A session a little bit later on. So as you can see on this slide, you can see there's lots of different job titles. Now, we don't have protected job titles. So you can see that some people on here, you might look at their job title and you might think, well, they're not eligible. But actually, all of the people on this slide have gained registration. So job titles don't necessarily reflect the level, and we understand that. But like I said to the previous question, you have to prove that you are working at autonomous level in a variety of different ways. Most people take between 10 and 18 months to complete the portfolio. So we do not advise that you start registration if you are already doing additional study. So if you're planning to change jobs, if you're already doing a master's qualification, if you're possibly planning to move house, any big life events, this practitioner registration is a big life event. It takes a lot of input from you, a lot of time, and it's not always time that you will get from your employer. You will be expected to do 50% of this work in your own time. So that's evenings, that's weekends, that's holidays. So you need to make sure that you're really committed and you really want to do it. It's a short term really, between 10 and 18 months. People often choose these days to rip off the Band-Aid and shut themselves in a darkened room for a weekend to do the writing. But you will need to expect to do that, and you're doing it on top of your day job as well. So you need to be aware of the commitment that's required if you start on this programme. I'm just going to check my slides. Okay, yep, just checking that we're on time. Okay, so here is a slide showing the process. I'll give you a second to read that. So at the moment, we are on the first square there, and this is arguably the most important one. If you're one of those people that goes straight to painting the walls without doing the preparation, the paint will fall off really quickly. So the self-assessment period is incredibly important, and it's to make sure that you do it properly as well. When we receive a self-assessment form that doesn't identify any gaps, it's not really realistic, because we all have areas of our public health practice that might need a bit of a refresh, that might not have been on a qualitative data analysis course for 10 years. If it's a really good idea to spend time on the self-assessment looking at, can I find certificates for all of the courses that I've attended? Because you will need certificates for every course you've attended, and you will need learning outcomes for each course you've attended. To show application, you will need documentary evidence of everything you said you've done. So, for example, if you say, I did a literature review for one of the standard 1.3, you'll need the documents from that literature review. So if you've changed jobs several times over the last few years, you're going to need to check that you can still access all of the documents that prove that you did what you said you did. Part of that self-assessment is identifying your CPD needs. So what do you need to do to get the certificates? And develop a plan of action that you then agree with your line manager. And all of this needs to be done before you apply to the scheme. Joanne's going to talk you through the Yorkshire and Humber scheme support shortly. But essentially, you go through the support programme, and once you finish your portfolio and it's been assessed and it's been verified, and at that point, you apply to UKPHR. And we recommend you to UKPHR. Without that recommendation, you cannot get registered. And that takes approximately 14 to 18 months for that application to reach that point. Okay, I'm going to pause for any questions at that point. Any questions come through?
Got a question that says, how long ago in the past can you claim some of the competencies or evidence?
Excellent question. Thank you for asking that. So the evidence that you need to provide in your portfolio is evidence of knowledge, so certificates and learning outcomes, and evidence of application, so proof that you did what you said you did. Now, in terms of the knowledge evidence, we acknowledge that a lot of people may have carried out training more than 5 years ago. So we accept some, excuse me, some of your knowledge might not be within the last 5 years. We need your application examples to be less than 5 years old. So when we come to the self-assessment discussion a bit later in the programme, I'll talk a little bit more about that. But if you've got certificates that are more than 5 years old, that's okay. But generally, we want things to be as recent as possible for the portfolio. The actual rule is 50% of all items of evidence need to be from within the last 5 years. Any other questions?
There's just one here that says, what happens if you undertake the practitioner registration process but then changed jobs before it was completed? Would you be able to continue the registration based on evidence and testimonies from your previous role?
That's a really good question. You can, yes, if you change jobs partway through. Now, it becomes difficult in terms of accessing documents and emails. So, for example, if I completed a piece of work, an evaluation of a project a couple of months ago, and I'm writing about that in my portfolio, I'm going to need to access all of the documents from that evaluation, possibly emails, possibly data, possibly the report. Now, if I'm no longer working for that organisation, I'm not going to be able to access all of that information. And if I take all that information with me and save it on a personal drive, I'm risking breaching GDPR. So it's really important to consider that before you apply for registration. It's not impossible, and a lot of people do. They might have the first part of their portfolio might be from a previous job, and then the second part of the portfolio might all be about their new job. But it's not really advisable to start registration unless you're quite settled in your current job role. Just because changing jobs is a massive life event in itself. By the time you've gone through the induction process, you've taken on the new projects, there's an awful lot of work involved in changing jobs. And if you're also trying to write your portfolio at the same time and live the life of a normal human being, that's a lot of pressure on you. So it's about sort of deciding when is the right time to go for registration. And I would definitely say you're at a period in your life when you're ready to take on a challenge like this, and you have the workspace and the headspace in order to be able to give it your best shot. Any other questions?
That's all I can see for now.
That's lovely, thank you. Okay, in terms of costs for the scheme, NHS England funds the actual support programme. They fund my role and they fund the University of Leeds to host the programme. But following your recommendation for registration, once you've finished your portfolio, then you will be liable to pay your registration fees, which you then pay on an annual basis. So you apply to UKPHR and you have to pay the subscription fee plus a small admin fee that you pay personally. It is tax deductible and your registration is then valid for 5 years. After those 5 years, you don't have to do another portfolio. You'll be very grateful to know. You have to keep a record of all of the CPD that you do, and you submit that record of your CPD with additional learning notes when you come to your 5-yearly re-registration. For every year, we submit a fitness to practice declaration to say that we're not under any restrictions, we're not under investigation for anything, and there's been no personal changes in our circumstances. We've not been convicted of anything that might impeach our fitness to practice. So annual declarations and re-registration after 5 years is what happens next. Okay, so for the next part of the session, I'm just going to hand over to Joanne to talk about the Yorkshire and Humber scheme.
Lovely. So as Alex says, I'm going to speak to you, give you a brief overview of what the Yorkshire and Humber programme team here actually offer you. So if you can move on to the next slide, Alex, please, on the practitioner support. So here, in brief, is what support we actually offer you at Yorkshire and Humber here. So today we've got the scheme webinar that provides you all the information. If there is any particular information that you've not got from here, or any particular unique information that you're wanting from us, then please do email us. We've then got an induction workshop, and we've got 3 sessions that are called portfolio skills workshops here, and they're designed to go from the beginning of an introduction. They're working on commentaries. Some of them are in person, some of them are online. Then we've got a reflective practice, which is including that, and that's by Dr. Susie Sterling and Simon Nazir Deforge. We then have 6 practitioner portfolio forums, and here, when you do sign up for the scheme, part of joining is your commitment to not only the portfolio skill workshop, but the 6 practitioner forums here, and all these are spread across the 10 to 18 months here. And here you'll meet other practitioners on your scheme, but not only that, the other cohorts that are undergoing their portfolio development, and here it's there to support you. Each session of the portfolio forums are designated to particular areas. Next slide, please. Thanks. Just another part of element that we actually support you with, we deliver CPD and masterclass sessions here over the next year. We have 12 currently that we are providing you free of charge. They are online, and in particular the blue ones are mapped to the 34 UK PHR standards there, and they will assist individuals considering going on the portfolio development there. The other sessions, the other 6 there towards the end of the year, are general continual professional developments. All these sessions are open for anybody working in public health, and all you need to do is apply online, and we'll be giving you the registration link for that in due course. I believe Lucy will be posting that in the Q&A there as well. If you want further information on that, we'll give you the web page as well, where you can find further information, not only about the sessions that we offer, but generally about the programme. Further support that we offer here, we will have a practitioner mentor, and part of the application here, you'll be required to seek your own practitioner mentor. And they should be conversant with the 34 UK PHR standards, and preferably not your line manager. Your line manager is there to support you and allow you time to be able to complete the portfolio within the designated time there. If somehow you are unable to seek a practitioner mentor, then if you do get in touch as part of your application, if you put a note on there, we will try to assist, but preferably if you can seek your own mentor there. Next slide, Alex. So part of your journey along the way is once you complete each commentary, it's going to be assessed by a UK PHR assessor, and they will be a public health professional with at least 2 years experience as senior advanced practitioner, and then again they will be conversant with the UK PHR standards, and they will undergo training with the UK PHR for their role there, and that's a voluntary role that they actually do. So each of your commentaries will be assessed. Once the portfolio is complete, it then will be passed on to a verifier, who is a registered public health specialist, and again they will undergo UK PHR training there, and they will quality assure your practitioner portfolio ready to go forward to the verification panel there. These time frames, as Alex has mentioned previously, between 10 and 18 months there. You'll have 3 commentaries. Sometimes it might go on to 4 commentaries, but preferably try and keep it within the 3 commentaries there. Your assessment process for that is, once you submit your commentary, it's approximately 3 weeks turnaround for your assessor. But bear in mind their roles are voluntary, and they do have other works, so it's just a bit of toing and froing sometimes, with depending on their availability. If you should have any clarifications, you should submit them within 2 months. And if there's any resubmissions, then that is within 6 months. Next slide, please, Alex. So if you are considering applying, applications will open later on today, towards the later end of the day. Applications, you will need to submit an application, yourself, assessment, your CV, job description, and this application will also need approval of your line manager. Completed forms will be required to be submitted to the PHPP at leeds.ac.uk, and applications will close on the 27th of February 2026. Once that closes, there will be a period of shortlisting, and then from that they will be online informal interviews in March, and you'll be informed of those days accordingly. If you require any further information from us, then as I say, please visit our website. You've got our email there, and also you can follow us on Blue Sky. These slides, as Alex has said, will be shared with you afterwards, so the links will be available there for you. That's it from me. I'll hand you. Well, actually, is there any questions in the chat?
There are a couple of questions.
Okay.
They both relate to mentors.
Okay.
So the questions are, can your practitioner mentor be somebody from your previous organisation? And does the mentor need to be UK PHR registered themselves?
Right. No, they don't need to be UK PHR registered themselves, and it can be from a previous organisation as long as they're, you know, familiar with the 34 UK PHR standards. Was there another part to that, Lucy?
Nope, those
Was
were the
that
two
answered?
parts.
Okay. Is there anything else?
Can a successful practitioner registration contribute to the specialist registration?
I believe that can. I don't know, Alex, if you know the information. Have we got the contact details for?
Yes, it can. I think the number of applications to the specialist training programme this year was something ridiculous, like 200 to 1. Everybody, the people that were successful, 200 to 1. So it's an incredibly competitive training programme. And I think definitely becoming a registered practitioner first does help with that. The two registers are slightly different in terms of the requirements, but definitely becoming a registered practitioner certainly helps on that registration process.
Thank you, Alex. Anything else, Lucy?
Yeah, just one more coming. Based on the timeline for applications and interviews, when would you begin the portfolio and commentaries?
Right. So we actually begin cohort 7, which is our next cohort to start, and that will be on the 20th of April. Part of today, after the session when the slides are actually sent out, there will be an information booklet that will give you all the dates of the practitioner timetable within that. For an example, at the moment, the first commentary that would be due is, I'm just quickly looking now. Can you remember off the top of your head, Alex?
No.
30th of September, so next year. But along the way, part of this support that's offered, writing your commentaries, all the information that you would need, how to do it, etc., will be provided in the support that Alex does give you there, and also part of the homework in one of the from one of the webinars. Sorry, not webinars, sessions. Alex will actually give you some homework to actually do a draft first commentary, so you'll be able to get some feedback on that. To assist you going forward, and that has helped. That is something that we've probably done within the last couple of years there, so at least it prepares you and you have all that knowledge and information there to be able to get to that 30th of September date there.
I would say that once you complete the self-assessment form, which we're going to talk about in a minute, if there's a lot of CPD that you need to do, it's worth accessing this CPD programme next year and then joining the scheme formally the following year. If you have already done the CPD programme last year, or if you've already got a Master's in Public Health and you've got lots of recent qualifications, then you would think about joining the scheme this year. But if you feel there's quite a lot of development gaps that you need to fill, I would definitely recommend you doing the CPD programme first and then the portfolio the following year. Okay, is that your bit done, Joanne?
Yeah, that's me done. I think we're over I'm just looking at see where we're at.
Ready
Over to you, Alex.
We're going to introduce Linda now, who has completed her own practitioner registration. So over to you, Linda.
So my name is Linda Mlunda, and I'm recently qualified as a public health practitioner. When I applied for the UK Public Health Scheme, I had been working primarily in research delivery and governance. And although my work aligned closely with public health principles, it did not neatly match the more traditional areas often highlighted in applications, such as health protection, health improvement, or even disease prevention. So it was mostly research-based. So I had completed my MSc in public health 7 years prior to me applying for this scheme. And so I had the knowledge background, but I didn't feel like I had enough the experience that would make me be able to manage to apply for this scheme. And I knew I needed to demonstrate clearly how I had applied my knowledge since then, since the time I finished my master's in public health. Yeah. So a major challenge for me was definitely navigating a predominantly research environment while actively seeking opportunities to strengthen my public health experience. So this meant being proactive. So I volunteered for relevant projects within the city council, and I contributed beyond my usual day-to-day responsibilities. I also looked for ways to support public health decision making and projects within my organization. And all these opportunities were not always obvious to me. So I had to proactively go and confidently look for these opportunities and willing to step out of my comfort zone, and so that I can ensure my application reflected uh, the genuine public health principles that are required for application. So the next slide for the NGO slide, please. So my journey into the scheme required a lot of persistence. So because I worked with the NGO prior to this, I wasn't successful in my first attempt to apply for the scheme, because my experience was not, as I said, predominantly public health. I had to work more. I felt like I had to work harder for this. So I knew that I had to apply again for the next year, because I always wanted to get my recognition as a public health practitioner. So for the second application, I knew I had to make it a bit stronger. So I refined my examples and my narratives, and I drew earlier experiences within the NGO and also my current public health research to the application, so that I can make it stronger for a successful application, which I was successful to apply. And by the time I reached the interview stage, again, now for the second time I applied, I felt more aligned with what the program was seeking and was more confident in my experience, and that's how I got into the program. So challenges that I faced, please, the mom slide, please. Another significant challenge that arose when I was completing my commentaries during the 1.5 years, I went on maternity leave. This was quite challenging because I had to balance demands for being a mum, and the academic and reflective requirements for the scheme. This wasn't easy at all. However, with the steady support of my mentor, who was very, very supportive, she really encouraged me and guided me through the whole submitting of the commentaries and working through my time in maternity within the required time frame. So I managed to able to complete it on time. And after this whole experience, when I reflect on it, it really taught me a lot of resilience, and important to lean towards your mentor, because you'll be given a mentor for this program, who are very supportive to be able to navigate how to finish the commentaries. With the scheme itself, it's the final slide, please. It was very rewarding for me. It really challenged me to transition from a primarily research-focused mindsets, as I work in research at the moment, to a more broader public health perspective. So one of the most valuable lessons that I gained was actually pushing myself to be proactive in influencing some of these challenging public health decisions within my organization, and be confident in having an input to some of these decision-making conversations within my work. So this is something I definitely would not have had if I hadn't gone through the scheme. This is one of the things I can definitely say I gained from the scheme. And since completing this registration, I have had the opportunity to explore a wide range of public health projects within my organization. I was nominated as the Equality, Diversity and Inclusion representative for our organization EDI working group, which are working with the Oxford Health BRC group, where we are collaborating with various NHS organizations and public health and public to increase involvement in research by underrepresented communities, and hence reducing health inequalities within the research environment. So this work has been very meaningful and motivating to me, as it reinforces my passion in addressing health inequalities and community engagement, and also as I think of working towards my long-term goal to be a public health consultant. So I've had also the opportunity to meet incredible public health professionals during my the impactful work I've done, and various connections that have allowed me to be able to appreciate this whole process. So taking on the role as an assessor also has been very fulfilling for me for the program, and it allows me to give back to the scheme by supporting other practitioners on their path to registration, as I was supported in my 1.5 years during this registration process. And it also helps me maintain my own registration continuity through CPD and PDR activities. And for anyone who's considering the scheme, I would really encourage you to apply, especially for those from non-traditional public health backgrounds, because public health is quite wide. So there would be definitely areas where you could influence public health within your organization. So I would definitely encourage you to value those unique skills and strengths in your experience, and be persistent if you really want to be in this sector to become a public health practitioner. Prepare in advance, be confident in your story within public health, and make your application, and hopefully wish you all the best. Thank you.
Thanks so much, Linda. Very much appreciate you coming on and talking to us today, and well done for gaining your own registration.
Thank you very much.
Are there any questions in the chat for Linda? We've got a couple more minutes that we can.
One question, which was, did you seek out these opportunities while you were part of the scheme, or was this done prior to your application for the scheme?
Some of the my evidence were already, when I was applying for the scheme, I already had prior experience within the NGO. So that was what I used for the scheme. But whatever you use for the scheme may change for what you're going to use for the commentary. So I did seek all these opportunities as I was in the public health scheme. So this was very helpful. It was very helpful to having a mentor who guided me through to which opportunities I needed to seek, or which was aligning to what I'm doing at the moment. And yeah, it was within the scheme that I seeked some of these opportunities, which I thought that maybe in my past experience I had not been able to fulfill some of the standards that were required for the scheme.
Thank you, Linda. Are there any other questions?
We did have one other question saying, would it be possible to ask Linda any questions after the session?
Okay.
Yeah,
okay.
yes, sure.
Thank you, Linda. Much appreciated. I'm just going to go back a couple of slides just to cover the next bit. So, because we've talked a little bit about this word, commentaries. So what does a portfolio look like? Well, the majority of the portfolio is made up of 3, ideally, commentaries. And a commentary is the story of a piece of work that you have done. So the first step in thinking about your registration will be to think about 3 pieces of work that you have done in the last 5 years. So they could be, for example, designing and developing an intervention. And each of those commentaries will contain a certain number of the UK PHR standards. And the commentary, if you like, is the vehicle for demonstrating your knowledge, understanding and application. I'm just going to show you what a commentary looks like. So let's choose this one. Now, at this point, you're drafting commentaries, you're just getting some ideas together. When you actually come onto the programme, we teach you how to put this commentary together. But I would just wanted to show you what it's going to look like. Sorry, I'm just finding it. Okay, that's fine, that's fine. I just want to show you what it looks like so you just get a rough idea. So this is a piece of work about the delivery of the Community Vaccine Champion Scheme. Now this has been anonymised just because I'm using it for training purposes. Now, as you can see, this commentary contains 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14. This commentary contains 14 of the standards. So it covers a variety of different aspects of this person's work. And this person will have written 3 commentaries like this, but all about different pieces of work they've done. And you can see that this commentary is 22 pages long. It's a lot of standards, I would say, in this. You could normally see around 10 to 12 standards per commentary. And we have a context section, followed by an own role section, telling us what they did, then the aims and objectives of the piece of work, and then we go on to claiming the standards. So this particular commentary starts off with the first standard, standard 4.1. And first of all, they talk about their knowledge of the standard. And you can see that they've included a course outline and certificate as evidence of their knowledge. They then go on to talk about their understanding of risks to health and well-being of the standard. And they then go on to talk about their application of the standard. So how they applied this knowledge of risk by doing this. And they evidence that in this email. So that's the actual how the work is presented. So before you even start writing these commentaries, excuse me, we have to decide what knowledge evidence you're going to use and what application evidence you're going to use. And that's where the self-assessment comes in. So for every one of the 34 standards, you have to demonstrate all 3 elements: knowledge, understanding, and application. Now, the knowledge section doesn't relate to the work that you're doing. It relates to your theoretical gaining of the knowledge about that standard. And you have to supply a certificate, learning outcomes, and describe the theory about the standard in the commentary. So when it comes to your self-assessment, you're firstly, at this stage, all you're looking for is, what certificate can I use for this? Or is it a gap? Do I need to do some more CPD? Understanding is simply described in the commentary. Understanding is the why. Why do we do this? Why do we think about risk, for example? But you don't need a separate piece of evidence to show understanding. Application is describing how have you applied that particular skill that theoretical knowledge in your practice. And that's where you give an example. And if we think about the risk one, an example of how I applied risk principles is X, Y, Z. And you need to evidence that. So we will think about that in a little bit more detail. But let's just look at the actual standards themselves for a minute. So there's 34 UK PHR standards, and they're spread between 8 what we call areas of practice. And you have to show knowledge, understanding and application for all 34 standards. And if you look at these titles of the areas of practice, so you can see area of practice 2, using public health information to influence population health and well-being. This is all about data, information, epidemiology. So those of you working in data roles are going to love area of practice 2. If you look at area of practice 7, that's all about planning, implementing and evaluating. That's the nuts and bolts, if you like, of how do we put population level programs and interventions together. So those of you that are working very much in practical roles will be all over area of practice 7. So the 34 standards are spread out between those 8 areas of practice, and you have to evidence all of them. It's 100% pass rate, if you like. And you need to show knowledge, understanding and application for every single one. So when it comes to the self-assessment, this is where sugar soaping the walls is so important, because you're going to try to think about 3 specific pieces of work that you have done over the last 5 years. Now, as Linda said, some of those may change as you go through your portfolio process. But what you need in order to be eligible for the programme is 3 areas of work. In your mind, you have to have that autonomous level experience. You need to have led the programme or been a significant contributor to that programme of work so that you can write about it. Because the documents that you provide as evidence of application must be written by you. So if you've developed, for example, a slide presentation, if you've written a report, if you've written the chapter of a JSNA, for example, these are all pieces of evidence that you use to show you doing each of those 34 specific public health competencies. So I'm just going to, let's have a look at a standard. So standard 2.5, interpret and present information using appropriate analytical methods for quantitative data. So to show knowledge of that, you would talk in your commentary about what is quantitative data, how do you analyse it, and use some of the key terminology. Plus, you would provide a certificate and a course outline of where you gained that knowledge. And that certificate and course outline is what you will be putting in your self-assessment. So when you're thinking about that standard, you think, oh, which piece of work did I do that involved quantitative data analysis? So you would put that standard in the commentary that included that piece of work, and you write about your understanding in the commentary narrative. And in the application section, you would talk about, this is the quantitative data that I gathered, this is how I analysed it, I chose this method because, and you would show how you analysed and presented that data. So you would, in the application section of your self-assessment form, you might put the title of the piece of work or the title of the commentary, plus the piece of evidence that you're going to use. You might say, final report and data analysis for XYZ, for example. But you must do this for every single standard, and that's why we give you until the 27th of February, because there's 34 standards that you need to do this with. So it takes a long time, and it's definitely worth you taking the time over it as well, because you might find some standards where you think, oh, I haven't done any CPD on that. I haven't got a certificate. So you've got between now and February to either go and book yourself onto a course or find an e-learning for health online course that you could do to fill in that gap before you join the scheme. So looking at the gaps is just as important as looking at the items of evidence that you will provide. So I'm just going to pause for a second there and ask the team if there's any questions.
Yeah, there are just a couple. So the first was, to evidence knowledge, if you have sourced your knowledge from a Masters of Public Health, how specific would you be expected to be? For example, could you show the module's learning objectives, or would you have to provide the specific lecture or reading material?
The learning objectives would be perfect. So you would supply your master's certificate and you would supply the learning objectives for the module that covered that specific skill.
There was just one more. Can you evidence the same standard in more than one commentary if relevant to the context of the commentary?
You don't need to. There's no point. So that's a definite no. Because in some of the work that we do, you could evidence it in all your commentaries, but no, you just claim each standard once. And to decide which commentary to put it in, you think about what item of application evidence am I going to use? So have I already got the emails or the reports from this project? Have I got the data analysis that I did for this project? So you put it in the commentary that relates to where you've got the best evidence. Each commentary should contain between 10 and 12 standards, ideally.
So we did just have a few more questions come in now. So how discrete do these pieces of work need to be? For example, could it be 2 pieces of work that evidence different standards within the same programme or completely different programmes?
Ideally, completely different programmes. However, if you work on one big programme, say, for example, you work in smoking cessation, what you would need to do is split 3 different work streams. So you might have one that's with smoking in pregnancy, you might have one that's with vaping, and you might have one that's delivering training to professionals, for example. So you could have, like, your work might all be within one particular area, but they must be discrete, different pieces of work within that area in which you work. There is more information on this in the guidance document, but it very clearly says that the aims and objectives for each commentary must be different.
So another question was, how much of the knowledge evidence can come from past degree qualifications?
Well, as much as you like. What we're looking at the point of assessment is whether you are a competent and knowledgeable practitioner today. So it may be that you're talking about data analysis that you did 6 months ago, for example. But when you're looking at your portfolio, you might think, actually, God, my master's qualification was done 10 years ago. That's quite out of date. So you can use certificates that you've done more recently to show knowledge. You don't always have to show your previous knowledge. And sometimes we've all done projects, haven't we, where we learned how to fly whilst we were doing the work and then backfilled the theoretical knowledge afterwards. So you can do that as well. You can also use things like mandatory training. So, for example, standard 1.3 is promote equality and diversity. Well, we've all done equality and diversity mandatory training. So use your mandatory training certificate as your knowledge evidence. Standard 2.2 is all about GDPR. Again, use your mandatory training certificate. So your learning can come from lots of different courses. It doesn't have to be degree or master's level qualifications. It could be, for example, that a webinar provided by your local LKIS team. You could provide, if you haven't done certificated learning, you could provide proof that you have done self-guided learning from textbooks, for example. And in place of a certificate, you would use what we call a CPD reflective note, which is like a mini essay, if you like, all about the facts and figures relating to the standard, all about the theoretical knowledge. But really, these should be used very sparsely. So ideally, courses, certificates, learning outcomes from CPD that you have attended, all of that can go together in your portfolio. Doesn't have to be assessed formal learning.
There's just a few more questions. So is there a word count for each commentary? Is there a capping to stop overworking here?
Not necessarily, no. I wish there were, because it would encourage people to write a lot more succinctly. Basically, we talk about 1 page per standard in an ideal world, but all of that will teach you how to do all that when it comes to the portfolio skills workshop. The most important thing for you to focus on right now is doing a really thorough self-assessment and tracking down all of those CPD certificates, identifying any gaps in learning or application, and filling those gaps.
Another question was, do you have to do 3 commentaries? The nature of my role is that I have done lots of smaller pieces of work which have met a range of standards. Could I submit these as commentaries, or does it have to be 3 big pieces?
UK PHR rules states that it's a minimum of 3 commentaries and a maximum of 5. So we say that really aim for 3. Some people do choose to do 4 commentaries, and again, that's just the nature of their work. But don't forget, they must be sufficiently different. So sometimes you might have multiple pieces of work that actually fit under one umbrella, like reducing health inequalities, for example. So you might want to put 3 pieces of work, small projects, under one umbrella, and 2 commentaries. So we can talk with you about how to map your standards to the commentaries once you actually come onto the scheme. But the key thing at this stage is really thinking about examples that you can show application. And we can discuss how you then group those examples when it comes to the portfolio development sessions.
So this is just a final question. Can you count the Foundation in Public Health Level 1 and 2 courses as evidence for knowledge if appropriate for the standard?
You can, but you will need to back that up with a bit more, because levels 1 and 2 are not at the right level for practitioner registration. We actually require level 5, which is degree level. However, you would provide your certificate and learning outcome as the evidence, and then in the commentary narrative you write about your knowledge using the right terminology, exactly what you know, and that bumps it up, if you like, to the required level for registration. But yes, it's a really good you can use those certificates, absolutely.
That's the last of the questions for now.
Lovely, thank you. Okay, so Now, let's talk about the evidence items. So, I said before, half of all the evidence items must be from the last 5 years. Now, let's think about this in terms of numbers. You've got 34 standards. You're going to need at least 34 different pieces of knowledge evidence for certificates. You may need learning outcomes as well. So if you're providing a certificate plus the learning outcomes as 2 different items of evidence, then that takes us up to 34 times 2, which is 68. So my brain isn't working too well this morning, so I'm doing it on a calculator. So that's 68 items of evidence. Now let's then add in the application items of evidence, which you will need possibly 1 for each standard, plus another 34. We're already at 102 items of evidence. Now, it's okay if 50% of those are more than 5 years. So if you've got some certificates that are more than 5 years old, that's fine. Because out of those 102 items of evidence, only 51 need to be from within the last 5 years. Now, the important thing is the evidence must situate you in it. So your name must be on the certificate, any item of application evidence. So if it's a report that you've written, for example, if it's a slide set that you have produced, your name must be on it. And if your name isn't on it, so say, for example, directors of public health often take all the credit for the work that we've done, so our name might not be on it, you would then provide a testimonial from a line manager to say, yes, I can confirm that Alex wrote this document. So if your name isn't on anything, you have to be able to prove that you wrote that document. But you can use evidence items more than once. So say, for example, you've put together a slide presentation about, I don't know, uptake of vaccinations. As part of that slide presentation, you might have had to do some data analysis to produce some pretty infographics for that slide set. And you might also, on one of the slides, be showing recommendations of how to improve vaccine uptake. So you could use that slide set to demonstrate application for a couple of different standards. So you can use evidence items more than once. If you've written a chapter for a JSNA, for example, you might actually be using that chapter multiple times for multiple standards, but sometimes you might be referring to page 2, paragraph 1. Sometimes you're referring to page 6, paragraph 4, for example. So think about your application examples on the self-assessment in relation to which commentary you're going to claim them in. Right, so I've got a task for you to do next, and it's relating to the self-assessment process. So I think one of the team can actually put the self-assessment form link in the chat so that you can access the self-assessment form. Is that right, team?
Yep, we can put that in, that's not a problem.
Lovely. So open the document that's in the chat. Have a quick read of the requirements. This is your actual self-assessment form that you will be submitting as part of your application. And I'd like you to look at each of these standards and write your knowledge evidence and your application evidence. Now, a top tip, remember this forever. In the guidance document, from page 35 onwards, there is detailed information about the requirements for each standard. So as you are filling in your self-assessment form, which you'll notice the standard is written out, so the first line will be written out. Have a look at the guidance document and make sure you understand the requirements of the standard. Now, the reason that this is such a hack of a tip is because this document is what the assessors use to assess your work. So if you use this in your self-assessment and in your portfolio, you simply can't go wrong. So let's have a look for 1.3, because this is one that I've given you to look at. Act in ways that promote equality and diversity. Now, I've already told you that you can use mandatory training. So in your knowledge column, you will be writing mandatory training certificate. When you're thinking of the application example to use, you should be thinking, what piece of work did I do work on equality and diversity? What did I consider? How did I consider the individual protected characteristics? So you'll be thinking of what application example could you use? Now, it could be here that if you've done an equality impact assessment, perfect. So you're in the application column, you'll be writing equality impact assessment for such and such a project. So that's the real top tip on how to use the guidance document. So team, if you could put a link to the guidance document and a link to the self-assessment form in the chat, then people can access that. Okay, so you've all had the opportunity now to begin the self-assessment process. So hopefully you've got a flavour of the depth that you need to go into in terms of reflecting on your knowledge and your application examples that you want to give. Now, I would recommend those of you that are working in organisations where you already have other registered practitioners, go and talk to people, go and ask them about the process, because you really can't get enough information from others at this stage. It's really worth fully understanding it, the processes that you need to take right from the word go. So spend a bit of time reflecting. In terms of public health practice, we all talk about being reflective practitioners, and we evaluate everything we do to within an inch of its life. We love a bit of evaluation. But how often do we actually reflect on the theoretical basis for the work that we do, and also how we have worked applying that theory to our practice? We don't, is the answer to that. It's very rare that we actually sit and think about what we do and relate it to the theory of the practice. So when you feel as if you're just sitting with your pencil in your mouth thinking about things, this is all really valuable time and a really valuable part of the portfolio process. Actually learning how to reflect is a skill in itself. So what I would recommend you do when you look at each standard, read the guidance document, read the paragraph about that standard, and sit and think about where you learned the theory behind that standard. Think about the different examples of how you apply that, and then think about it in the terms of the portfolio. So which piece of work did I do this in? Which commentary could I claim this standard in? You could even go one step further if you complete all of the standards, and you could colour code your self-assessment form. So for example, green might be all of the standards that you're claiming in commentary 1, yellow for commentary 2, for example. And once you finish that self-assessment, start gathering the evidence items. If you're one of those people that doesn't keep certificates or chucks them in a drawer, you might have to have some quick CPD courses that you might have to find. But embrace those gaps as well. This isn't a test, okay? We're not testing you to see if you're ready to complete the portfolio. It all comes out in the wash at the end of the day. So the more that you do now, if you're not sure if you've got a certificate, go and find some CPD that you can do to fill that gap. If you're not sure you can access that document, think of others, think of other examples. It really will help in the long run, because when we actually start the portfolio development process, you're going to be needing to draw on these things from the word go. So the more that you've got to hand, the more that you can focus on the actual nuts and bolts of writing the commentaries and putting the standards together. This business of gathering the evidence and doing the CPD really is the same as sugar soaping the walls prior to starting the painting. Were there any particular standards that you found more challenging to think about evidence examples for? If you'd like to just put any comments in the chat about how you found this process, or if you had any difficulties, that would be really helpful. Team, if you can let me know if anything comes through.
Scott, question now. I have recently moved from the NHS to local authority. My NHS email is no longer accessible, and I am concerned I will not have some evidence, e.g. emails to hand. Is there a way around this?
There absolutely is, and that's that you're going to have to write your commentaries about pieces of work that you're currently working on. It's, as I said before, it's very difficult to retrospectively gather evidence from a previous organisation, and by doing so, you actually risk breaching GDPR. So it's much better to think about the projects that you're currently working on and mapping the standards to examples that you can get evidence of. Don't forget, your commentaries don't have to be about massive pieces of work. This is one of the mistakes people sometimes make, because they think, oh, I did a huge population programme in a previous role. You know, a title of a commentary could be something as simple as carrying out a consultation with a community. Could be a small piece of work, evaluating a programme. These are all distinct pieces of work that could be done. They don't have to be, you know, great big population level pieces of work that have been carried out over months and months. It could be planning an intervention. Could be scoping an intervention involving multiple stakeholders and consulting with people. They could be quite, when it says discrete pieces of work, it just means, you know, nicely write-upable in a commentary. Any other questions come through?
No other questions yet, no.
Fantastic. Sounds like everybody must be on track and understand how to self-assess. Okay, so next steps. So think about your pieces of work, maybe make a few notes about each one you're going to use, and complete the self-assessment form. Now, when you identify some of those gaps in knowledge or application, get on with finding how you're going to fill them. Talk with your line manager, talk with anybody that you can find who's completed registration or is an assessor. Find some courses that you can carry out. There is a lot of public health learning on e-learning for health nowadays that you can all access. So if you have a look around e-learning for health, you'll be able to find some good short courses that you can carry out. And look a bit broader as well. There's public health courses that are free on FutureLearn and Coursera. So there's lots of opportunities. And again, talk to your line manager, because each of your organisations has also got a training budget that they may be able to put in place some training for multiple people in an organisation. So really start not just self-assessing, but also filling those gaps. You've got until February next year to do this, so it's a really good idea to really do it thoroughly. Or consider if there are a lot of gaps, then it may be good for you to do the CPD programme next year and then apply the year after. The self-assessment form is a document that you will use throughout your portfolio journey, though. It's not just something that we get you to do to get on the scheme. It's a current document right up until you submit your final standards for review. And the easier the process will be in the end. I can absolutely promise you that. Does anybody have any further questions?
There is another question, which is, can you use pieces of work you're currently doing that are not yet completed?
Absolutely. And in fact, that's a really good idea to do that, because it may be that you think, oh, I'm just about to do a literature search for this. Perfect, you can do it and then use it in your portfolio as well. So yes, absolutely, you can do that.
And there's no other questions yet.
That's great, thank you. Is there anything else from Joanne or your team that you would like to let people know? How are you going to send out the documents to everybody attending? How are you going to do that?
Yeah, what we're going to do after this session is we will send a follow-up email with the relevant documents attached, and there'll also be our email on it if they need any further information with that. So there'll be the guidance there, along with the baseline assessment and the application form and the scheme information booklet.
Thank you, Joanne. And how many people are we accepting onto a cohort?
So it's 15 places that will be available for cohort 18. Sorry, 18. Blooming heck, I'm thinking way in the future there. So there's 15 places available. We have a couple of practitioners that have deferred from previous years. So I think that's down to 13. It's actually reduced down to 13 this year.
Okay, and it's a really friendly and supportive scheme. As you go through, it really is a step-by-step process, and the team in Leeds obviously support you through the CPD programme, and I support you through the actual portfolio development side of things. There's lots of other resources that we use as well. We use an online K-Hub platform for documents. And we see each other regularly, so we help each other with that motivation that sometimes we all need a bit of in order to keep going. It's a long process, but I would absolutely say it's 100% worth it. And once you've got your registration, it really is a milestone in your public health career. You know, putting that you're a registered public health practitioner really means something. And people often say to me, I'm not sure whether to do a master's or whether to do registration. I would say registration is more valuable. If you've got the opportunity at some point, do both. But professional registration proves that you can practice. A master's qualification proves that you can learn. So two completely different things. This isn't a training program. This is a retrospective consolidation of your skills and your theoretical knowledge. So you're expected to come to this programme with all of that knowledge and skills in place already. Now, we all have a few gaps, and if you've got a few gaps, as long as you've got a plan to work on those gaps, that's fine. You don't have to have all of the answers at this stage. As Joanne said, there's a comprehensive CPD programme that goes along with the programme. And quite often you might get to some of those final standards as you're writing them and think, oh, I thought I had a certificate for these, but I can't find it. You can still go back to fill some of the CPD gaps as you're progressing on your portfolio. So we're not expecting you to be able to sit down and start writing the second that you're accepted onto the scheme. It's very much supported, and it's very much a step-by-step process. And we're a pretty friendly bunch as well, so you're among friends. Any final questions before I close the session? I really would appreciate. Oh, okay. I just say I really would appreciate if you would fill in the evaluation, because that will help us to get it right for next year, and the QR codes on the screen. Okay, questions?
Does it count as evidence if you co-wrote it and your name is on it, but it's alongside others?
Yes, it absolutely does. That's fine. We don't expect you to have done like every single bit of the work yourself. We know public health is a very collaborative style of working. So there's always going to be others, but we just need to make sure that your name is on so that we can see what your role was.
Okay, and the final question was, I have some great examples of consulting the community as part of my role. However, how would I be able to evidence this via a certificate, for example?
Well, that's two different types of evidence that you're talking about there, because your evidence of application will be anything you've got that shows you consulting with the community. So did you use questionnaires, or did you use QR codes that link to forms? How did you consult with the community? All of those things, that is the application evidence. Now, knowledge evidence of how did you learn how to consult with communities may be missing, maybe a gap. You might need to go and find some training to fill that gap. But as I said before, a lot of us have done application examples, but not always had the benefit of having training before we did it. We learn from osmosis, we learn from colleagues, we learn as we go along, we learn on the job. But it's a case of backing up that on the job learning with something a little bit more concrete. What you could think about doing is using textbooks. So here I've got the Oxford Handbook of Public Health Practice. It's only about 16 quid, I think, from Amazon. Now, it could be that you read the chapter of this that relates to consultations and engaging local communities, and then you would write a short CPD reflective note. And that is then in place of a certificate, because that shows your knowledge. You're sort of regurgitating, if you like, what you've learned, and you're showing the assessor that you know the theoretical base for why we consult with communities, how we do it. So the CPD note would then become your knowledge evidence, because that's the theory that underpins the application example of what you did and how you consulted them. There is in the guidance document a really good section on showing knowledge and application. I'll just go back to the beginning of this document. So on page 9 of the guidance document, it talks about how you demonstrate knowledge, understanding and application. So it says knowledge may have been gained through learning on formal courses, on the job learning, and it tells you all about how to prove that knowledge. So have a good read through and make sure you understand the difference between knowledge and application before you complete your self-assessment. Any other questions?
There was another one. Would reviewing journal articles be sufficient to evidence knowledge rather than going back 20 years to a qualification?
Well, it would, but you would write a CPD reflective note. And the reflective note would then show, it give your opportunity to display your knowledge. So yes, you could do that. But I think going back to the qualification would be okay as well. You could say, I originally gained the knowledge by attending this course 20 years ago. However, I've updated that knowledge by reviewing these articles. See the CPD note. Always a good idea to show CPD if your qualifications are very old. When I say very old, I mean more than 5 years old. You could even just say something like, I keep it up to date by being part of the local knowledge and intelligence network, or by attending a conference, or by subscribing to a bulletin. These are all different ways in which we keep knowledge up to date. It's not all about formal courses. That's it then. Well, I very much look forward to meeting some of you when you actually apply and join the scheme. I'm sure the team would be happy to answer any further questions that you might have outside of this session. And thank you for coming today. And yeah, here starts your journey to professional registration. Thanks, everybody.